Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop knee bursitis pain at home. But before I do that, we need to understand what is bursa or bursitis and the causes, the risk factors, and the symptoms of knee bursitis. And then I will go over important steps you can do at home to stop or relieve your knee bursitis pain at home. So what is bursa? Bursa is a fluid, look like sac that's everywhere in the body. It's actually a small, and it's located between the joint, usually located around the joint, and it's kind of cushion between the muscle, the bone, and the tendon. So when we look in this image, the blue colored, that's the bursa. We have to have that throughout the body, especially in the joint area, as a protective mechanism, so the tendon will not rub against the bone and cause inflammation. It's kind of like a protective cushion tissue that should be everywhere in the body. So when we look at the knee, there is a lot of bursa over there. So you can see here in the top of the knee, underneath the quad muscles, and actually in the front of the patella, there's a bursa here, underneath it another bursa here, another bursa here. So we need to have those bursa. The problem is when you start to have bursitis and anything ending with itis, that's a sign of inflammation. Itis stands for inflammation. So this is the front of the knee, and you have the patella underneath here, and we have the quad tendon, and it's attached all the way down to the bottom here. And we have the ligament, the medial and lateral collateral ligaments, and you have your meniscus here, the blue part. So we have bursa everywhere around the knee joint, and that's bursa to protect the tendon from rubbing over the bone. So we have a bursa here, we have a bursa here, we have a bursa here, we have a bursa here. We have a bursa here. You don't see it here, but that's usually the location of the bursa. You have a bursa here in the back, bursa here, and so bursitis, it's typically is inflammation. Anything ending with itis is inflammation, and you can see here in this image the redness and the swelling here, and that's the inflammation in the bursa area. And typically with any inflammation, you will notice there is a redness, swelling, and warmness in that area. And patients who have knee bursitis will experience a decrease or stiffness in the knee joint and pain and tenderness when you touch it. And you can see here with the bursitis, that's the bursa here is normal, and here it starts to swells up and increased in the size. So causes and risk factor for knee bursitis. One of the main causes is repetitive activity, especially kneeling, if that's required by your occupation, kneeling a lot, and that cause rubbing over the especially the patellar bursa, and that's inflamed. Squatting, repetitive exercises or sports activity like wrestling, football, running, and volleyball. And the other risk factor is obesity, overweight. Very common risk factor is muscle tightness. So if you have a tightness in your muscle, especially with those patients, they usually have tightness in the hamstring and also tightness in the IT band, and that is actually could cause imbalance in the muscle, like pushing the knee to one direction compared to the other direction, and that cause more rubbing in the bursa area and cause bursitis. The other risk factor is osteoarthritis. If you have osteoarthritis in the knee joint, or rheumatoid arthritis, that's a risk factor. It's already inflamed there. When you start to have that, you have a lot of imbalance in the muscles, and that could increase your risk of having knee bursitis. So the other common reason is blow to the knee. If you have any injury, accidents, or fall on the knee, that could cause knee bursitis. So how to treat the root cause of knee bursitis? Before I go over that, we need to understand the normal healing cycle so the treatment will make sense on how to address the root cause of the problem instead of masking the symptoms. So our body has to go through 3 stages in order to heal. You can see it in this image. The first stage is inflammation, swelling, redness, the blood starts to rush to that area. I'm using external paper cut here for visualization, but the same process happens internally in the knee, but you don't see it because the skin covers it. If you have really severe bursitis, you will see swelling and sometimes redness in that area and calcification if you're really kneeling a lot for a very long time. So you might be able to visualize the inflammation part of this cycle. Second stage of healing is a proliferation stage. So during this stage, there's a cascade of events. I will focus on the scar tissue just for the sake of our time here. So our body has to build the scar tissue to heal that open wound or tear that happened internally. If our body does not build the scar tissue, it's open wound susceptible for infection. So we really need the scar tissue for the body to heal. The problem is when you have too much scar tissue in the bursa area that cause more inflammation, cause more rubbing on the bursa, and cause chronic condition. Perfect scenario, actually, during the maturation stage, your body should resolve all the issues that happen during the inflammation and proliferation stage, like resolve the inflammation, get rid of this scar tissue, release the fascia restriction, and the body heal. If you have chronic condition, there's very high chance your body going back and forth between inflammation and proliferation, which means there's a lot of inflammation and a lot of scar tissue, a lot of fascia restrictions. And when we look here by the definition of bursitis is inflammation, but it's not only inflammation, because when you have that swelling area, there is a scar tissue there. There's always fascia restriction, and some of the patient will feel like muscle spasm in the quad, the hamstring, a lot of tightness around those areas. So how to treat the root cause of the problem? Before I go over that, I'm going to go over some of the treatment that currently used that's not effective based on the studies, so you don't have to waste your time on those treatment. And we're going to relate those treatment to the normal healing cycle, so it will make sense why these treatment does not really work. So first thing, and what we learned in the school, just use ice and heat. Ice is temporary, decrease inflammation. If you're lucky, it's gonna cause temporary pain relief for half an hour to an hour. When we look at the healing cycle, does not really do much for the inflammation, does not do anything to the proliferation stage. So it's temporary. The other thing we use is electrical stimulation. Based on the study, it provides temporary pain relief. If you're lucky, half an hour to an hour, and the pain comes back. But when we look at the healing cycle here, it does not decrease inflammation, does not break scar tissue, release fascia restriction, does not do anything. So it's masking the symptoms. The other thing that's commonly used is foam roller and massage. I'm going to combine those together. Based on the studies, they do not provide long-term pain reduction. You might get temporary pain relief, but think about this way. If you have inflamed bursa and swelled up, if you massage it or you continue rubbing the inflamed area or rubbing open wound, you're going to make it inflamed more. You're going to cause more scar tissue. So, and massage and foam roller are not deep enough to go to do deep release, especially the muscle tightness in the quad, the hamstring, and in your IT band area. And when I go over the fascia system, it will make a lot of sense why foam roller and massage are not effective. So the other thing that's used by a lot of healthcare providers like physical therapists or chiropractor is joint mobilization. But think about this way. you have inflammation in the bursa. If you mobilize or adjust or move the joint, that's really not doing much to the inflamed area, or does not break the scar tissue, and based on the studies is not actually provide long-term pain reduction, and a lot of studies show it's not even short-term pain reduction. So it's basically doing something different than what you actually need to treat the root cause of the problem. The other thing that's commonly used, and I don't recommend to my patient, is stretching. So based on the study, is actually stretching cause inflammation. Think about it this way: you have the inflamed area. Your muscle should act like a rubber band. When you contract and relax, it should stretch like this. So when you have a micro tear or inflamed area, and you start to stretch, you're gonna tear it more, you're gonna inflame it more. Based on the study, it does not provide long-term pain reduction, and also the problem is overstretching. You're gonna cause more inflammation, more scar tissue, and could cause more damage. That's why I don't recommend the stretching, because when you look at the healing cycle, it's going to cause more inflammation, but it's not going to do anything to the fascia restriction, muscle spasm, and trigger points. So the other thing that's been used a lot is strengthening exercises. We need to do that, but we need to do it on the right time, because if you do it while you have a lot of inflammation, you're gonna inflame it more. And instead of doing the strengthening exercises, doing function training is much more effective based on a study, and I will go over how we can do that. So to really get to the root cause of the problem, we really need to work on the healing cycle on the inflammation stage and proliferation stage. So if you are in acute stage with a minor inflammation, just rest. So rest for 5-7 days. Avoid the repetitive motion, that's kneeling or running or jumping, that cause more inflammation in the bursa area. 5 to 7 days should be good enough to really take care of minor inflammation, and you start to go back to normal. And if you kneel, you need to wear a knee pad. So that's for inflammation. For someone who has a moderate to severe inflammation, like in a chronic condition, that your body going back and forth between inflammation and proliferation, we have to address both ends of this cycle simultaneously. So for moderate to severe inflammation, I usually use the Magna Heal. This is a very strong magnet that used to decrease inflammation, and I usually have patients wear it around the knee to decrease the inflammation, sleep with it. For mild inflammation, usually with the Magna Heal, a few minutes, that should be good enough to really get the inflammation under control. For moderate to severe inflammation, patients usually need to wear it for longer time to decrease that inflammation. The other thing I like to do with all of my patients is put them on an anti-inflammatory diet, because there's certain food like refined carb, refined sugar, it's actually cause internal inflammation in the body for 4 to 5 hours after eating. So, and that's decrease or inhibit your body ability to heal. So I put my patient on anti-inflammatory diet to make sure that there is no ingredients that actually slow down the healing cycle. And the other thing that's very common with chronic condition, especially if you have osteoporosis or rheumatoid arthritis, chronic inflammation and obesity, there is a very high chance that you might have vitamins, mineral, or hormonal imbalance. And in general, that slows your body to heal everywhere. It's not only in the knee. So one of the things you can do actually today, take advantage of Ask ASTR. It's a free online medical evaluation. Just go to askastar.com. And the software, it takes about 5 minutes to answer the questionnaire. The software will guide you through the process, what you should do to address possible vitamins, mineral deficiencies so your body heal fast. It's very quick and it's very comprehensive evaluation. So at the same time, while we're working on the inflammation stage, we have to address the proliferation stage. So bursitis is inflammation, and you also have some scar tissue and fascia restrictions. So what I personally do for the proliferation stage, working on the superficial scar tissue and deep scar tissue, I use the A3 to work on release the scar tissue. And typically when you have bursitis, we have to work on the whole knee and leg and the thigh muscles. So what I do, I release the scar tissue, the fascia restrictions around it, and also release the quad, the hamstring in the back, and the IT band, because I have not seen a patient with bursitis that they do not have issues and tightness in the knee muscles that actually pulling and causing more issue with the bursa in the knee. Yes, your bursitis here, but a lot of the knee muscles attach here that cause malalignment in the knee joint that actually lead to bursitis. So we have to release the whole thing. So I use the A3 to release the superficial scar tissue, and I use the A5 to go deep to release trigger points, fascia restriction, and scar tissue. And that's why I said massage and foam roller are not effective, because foam roller is barely rubbing over the skin. It's not going to go deep enough. And what I learned in the school, using knuckle or elbow to do deep release, but mechanically is impossible to go deep to cause physiological change. That's why I like the A5, because think about this way, and it's very typical with bursitis, you have deep scar tissue in the hamstring muscle, and the hamstring muscle is very thick for a lot of people. So it could be like 1 to 2 inches at least thickness, and you might have scar tissue very deep, and when you palpate, will feel not very deep. So if you cannot go deep enough to release it, you're not going to be able to release it. Why? Because think about this way, if you need to unscrew a screw in your motor in your car, the short screwdriver will never gonna reach to really unscrew that the screw. And that's the exact thing happen internally. If you have trigger point, if you have scar tissue, fascia restrictions, if your hand or elbow cannot go deep enough to release that area, it's physiologically impossible to release it. We have to go deep enough to release it. That's why foam roller and massage are not effective, because it's impossible for you to go deep enough to cause that physiological change. So the other thing we have to work on is the fascia system. Briefly, I will go over this because this system extremely overlooked by a lot of healthcare providers, and it's an extremely important part of the treating the source of the problem. When you understand the anatomy of the fascia system, it will make a lot of sense. This is extremely important part of the treatment. So the fascia, the superficial layer of the fascia, it's like a wrap surrounding the entire body. It's like a Spider-Man suit wrapping the entire body. You can see it here in this image, the white tissue, that's the fascia. And you can see it here in the cadaver, the white tissue, that's the superficial layer wrapping the entire body. To make things more complicated, there is other layers, but don't worry, the treatment is very simple to address the fascia system. But the fascia system is divided to 2 layers, superficial and deep layer. And those layers, especially the deep layer, is divided to 4 subcategories: the apparatic fascia, the epimysin, the premiysin. To make it more complicated, actually, each of those layers has 1 to 2 sub-layers on the top of each other. So the superficial layer has 2 to 3 sub-layers. The apparatic fascia has 2 to 3 sub-layers. So when we look at this image here, you will see the apparatic fascia. The aponeurosis of apparatic fascia is like the fascia layer that's wrapping a group of muscles. The epimysin, a fascia layer wrapping each individual muscle fiber. The premiysin, a fascia layer that's wrapping a bundle of muscle fiber, and you can see it here. You can see it here. That's the premiysin. And then we get the endomysin, the layer that's wrapping each individual fiber. So why I'm going over that complex system? Because if you understand anatomy, it's mechanically impossible with foam roller or massage to go deep enough to cause mechanical force, to cause physiological effect. That's why I like to use the A5 and I use the A1 to release those layers. So the treatment is extremely very simple. I use the A1 to release the apparatic fascia and the superficial fascia, and I use the A5 to release the epimysin, premiysin, endomysin, the trigger points, and the deep scar tissue. So, to wrap it up, what you should do at home. If you are in acute stage with a minor inflammation in your bursa, very simple. Stop the kneeling that cause more inflammation, or the activity that actually cause more inflammation, like jumping, running, for 5 to 7 days, and that should be good enough to really decrease the inflammation and get you back to normal. If you are in the moderate to severe inflammation and your body going back and forth between inflammation and proliferation, 5 to 7 days will not gonna be enough, because we have to intervene to decrease the inflammation. We have to break the scar tissue, release the fascial restriction, muscle spasm, and trigger point. So if you kneel a lot, I recommend to avoid that, or if you have to do it, you have to get a knee pad. That's the other thing. So to get to the root cause of the problem, we really need to not pick and choose what area to work on in the healing cycle, but release up everything, especially your quad muscles, your IT band, because it's very common to have IT band tiredness, your hamstring, and work on the inflammation simultaneously. So if you have any question or comment, leave it in the comment section below and I will answer it in the future video, and I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to astrinstitute.com.